Thank you. I'm trying to bring, such a qualified and diverse audience, because I know here you have all different stakeholders, people working from public institution, employers, business, unions, academicians. And so I'm trying to have something that might be broad of interest from everybody about this very challenging problem. So, trying to start a little bit of focusing on mental health, we heard about awareness, and also about how to translate in policy. But if you just take the definition of health as defined by the World Health Organization, even if it's from the late 40s, so long time ago, was so modern, so contemporary. Health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And again, still WHO is defining mental health as a state of well-being in which everybody, every individual realizes his or her own potential, can cope with normal stresses of life, can work productively and fruitfully, and is able to make a contribution to her or his community. So we had a lot of keywords on this definition, but I think it's a very complicated angle how you want to focus, because if you want to focus on determinants, what are the determinants affecting mental health? They can go something related just to individual, age, gender, hereditary factor, individual lifestyle, social and community networks. But then there are also something that are related to more food, education, work environment, living and working condition, unemployment, water and sanitation, healthcare services, housing, and also the community where you live in, general socio-economical and cultural environmental condition. So out of this very wide variety of diversity, the question is, what are the work-related determinants, and why we focus on determinants rather than just outcome? Work is a wide spectrum of this that might be related directly or partially, like education, work environment, living and working conditions, still the unemployment itself. But the main question that's very common in the debate, and it's probably one of the things that make it more worried, employers and business, and say, what can I do to take care? Of course, I can help individuals to cope, to make resilience, to make a good climate, but is that enough, is what this policy is about? The question is, can we deal with these determinants, with this factor, in particular on work environment, like we did successfully from others that we were able to manage very well? I mean, here, this institution is organizing SafeWork was very successful in handling and managing other risks, like, for instance, asbestos, where we also learned, for instance, from when we set up at that time our register of mesothelioma, we learned it a lot, and we came here to benchmark a little bit what was done here in Australia. So can this be handled? Because that's the key question. What we can do to assess, manage, and make intervention, how we can decide to have policy that are action-oriented to manage this risk. So one of the compromise not to take care of other issue, because of course if you take in a personal problem, because you're getting into a divorce or there is an economical crisis, the single business cannot take care responsibility of this, can help in having the best way to cope with this. But what I'm trying to talk is something different. the overall management. How can we deal? And I really like what your minister at the opening, she said that it's about leadership. So the first thing is how to take care of this. So work-related stress, which semantically, it's quite of a very not very nice word. What does it mean? This is very common in European policy. Work-related stress, of course, when demand of the job exceeds the employee's capacity for coping with them. And we have just to say that not all the manifestations of stress are necessarily related to work, as I just said. Okay? So the determinant, the fact related to work and context of work. So what is, and we come back then what we mean. When exposure is to an intensive pressure and is prolonged in time, we might have some temporary, and that's not what we're talking about, but when it's prolonged in time, that's another part of the definition. And the last part is that the personal resources. We have to understand that different individuals react in a different way, and they are less or more tolerant to different situations. But even the same individual, in different time of their life, they might react in different way. So when we come to research, I mean, here there's a lot of academician. I mean, I know very well, and we work together with Maureen, but I know there are other, and I see also from the program that there are a lot of people working in research and teaching. And that's something probably that always in a pattern, coming in a management come first. First is research that try to understand a pattern, an issue, the determinants, and how to deal. And then if the research is consistent and it's relevant, okay, so when you get research, then it comes policy, and then policy is not enough sometimes, because you might have a well-established policies. You know, if you take Russian policies at the time, at the Soviet time, you get the limit value that were very strict, but nothing really happened at that time, you know? And then from implementation, the implementation goes into research again, because then you have to monitor in an integrated system. Okay, so here, probably even if you don't read, what I try to see and what we will see, that already from the 50s, we have 70 years of research, we have different development coming from models. They came from definition, understanding the problem of stress and how to manage, and now to integrate it in a taxonomy and translate it into action. And then policies in Europe, they start to be alerted. We have a framework directive in Europe which is called 391, which is the mother of all OSH directive. They already in some specific directive, they started to include some work organization, but very softly, I mean, very partially, and that makes a way to integrate it. So what really changes were disagreement, where we will come back, which are some soft policies where basically they put together social partners to make an agreement how to deal with work-related stress, and after that on harassment and violence at work, and then there was a European Pact on Mental Health. And then we come to implementation. In different countries at level, as I said, you might have policies, but people say, okay, now we have a policy, we have enforcement, but the government, the institution are not helping us how to do it in a way that this can be not measured. You know, a very common comment, we're not talking about noise that we can measure, we know how to reduce it, where it is. We're not talking about asbestos, where you can measure fibers or dust. We're talking something very complicated and integrated. Can we deal with this? So on the top, you see some implementation model coming, including what I put in red, our methodology that we launched in 2011. Coming from research, I think what it's starting, you know, trying to summarize what we show in a framework in the previous slide. The first, I mean, really breakthrough model was the Karasek model. Why model do count? Why are so relevant? Because models are the ones that make it possible translating into evidence-based action. This model was made actually by an architect. His name is Karasek. He's an American architect who came for a summer school in Sweden and met this other fellow, Theorel, and they worked together in a very strange way that at that time people had time to understand what they were talking about. But basically, the same rules they apply to architecture or engineering, where you put together different forces, like the decision and control with the quantity demands that are coming from work, how these are balanced, they are the major, let's say, one of the major models. And the next one, that's the other model that came from the 90s, from Johannes Sigrist, who's putting together more things, which is the effort-reward imbalance. The effort is, of course, is demand, but also motivation. Reward is also what you put and what you expect from your work. It's like a marriage. If this is breaking, if it's an imbalance, then you have a problem. It's not only about income, it's about career mobility, job security, esteem, respect from your company, but also from your colleagues. I mean, these two models together, the way they were delivered, they develop also tools how to measure these things. Okay, all these things, they were put together, and basically the taxonomy, what we call. Tom Cox, later on, they tried to put together these models and translate in how to put the context and the content of work. Context means organizational function, culture, what is your role in organization, career development, decision latitude and control, the relationship, and the homework interface. The content is how the work is designed in terms of task design, workload, work pace, work schedule, shift work, how it is, and you see the condition and the hazard. And then he made this with the taxonomy possible to translate similarly on the model from hazard to risk assessment and then risk management. So then we came to the definition of psychosocial risk. Those aspects of work design and the organization and management of work in their social environment and context, which have the potential for causing psychosocial and physical harm. And when I say physical harm, it's concrete. It's not only about psychosocial and mental health at all, but it's about health. And we'll see this. But what we have, our history that we had from this taxonomy, so that the research was very clear, and somebody was saying from research, it's time to act, time to move to policy and to action-oriented. But then there was really a struggle, which was in Italy, but I would say it's larger, was at Europe level. Well, from one side, I would say this was about 15 years, from 1990 to 2004, when the agreement was made. And mainly the struggle was between trade unions and employers, where basically from one side the trade unions were pushy, but they were also making some mistakes because they were using the general psychosocial for other issues related to the usual negotiation they have with the employer. The employers, they were saying, we cannot take care of something we cannot control. It's like opening the Pandora box. And this was basically stuck because nothing really happened in policy. And of course, the academicians, they were saying, and practitioners and companies. What changes this? First, there were evidence, clear evidence that we are not only about talking about mental health, but we're talking about health as broad. Because when this model, this high demand control and effort rewards are imbalanced, then you have also impact on cardiovascular mortality. These are very consistent. I mean, now we have many systematic reviews showing these things. And a large, these are also related to stroke and diabetes. And also long working hours are related to consistently to stroke, and job insecurity also to coronary heart disease. And of course, also, we were hearing before how to deal with, to take care of people that have depression and not to have a stigma, how to deal and support them. That's very important. But we also about talking determinant, causing of depression. So there is also another important issue, in addition to this, that this depression symptoms, psychosocial work environment. There is an association, particularly on the control and the job strain. There are these three, where are very relevant in this study published in 2015. And we heard before, about costs. Also in Europe, we have similar estimates where mental health as a whole, but also the productivity. So from one side, there were more consistent evidence that it's about health at whole, and the other productivity issue. I mean, particularly sick leave in the late 90s was very strong in the agenda. And there was even a case in Sweden where a minister resigned for bad management of sick leave. And the 20 billion euros in Europe is what is estimated to be the cost of work-related stress, which is part of the big picture of mental health. So when we came to legislation, can this be translated? What kind of legislation? We have hard policies, and we have a whole bunch of directives for anything you want to do, the manual load handling, specific chemical agent, biological agent, noise, vibration, whatever you want. And then we have soft policies. We have resolution, recommendation, and social partner agreement. What I think was very smart from the European Parliament and Commission, they delegate this specific topic to social partners. So they went through, in this 15 years of just being stuck, to use the social partner agreement. So they left to the social partner how to regulate, and we came to this to legislation. I mentioned before that even other directives, so they are more hard copy, they include like working time, work display agreement. There's some specific issue related to work organization. But the key point was that we made with Stavroula Leka and the group in Prima in Europe also an assessment of the impact of policies. Here you see the hard policies, and here you see the soft policy. And soft policy are even more effective in terms of coverage and of mental health. So even if we think that soft policy are something that is just formal, it makes engagement, and it makes a way to react because you empower the social partner to find a solution. And what happened also at the different member states? I mean, I learned also that here in Australia you have a framework approach from the federal government, and then you have different states, there are different ways to implement this framework. So how this framework directive? We have 8 countries, including Italy, that decide to apply with hard policy, so with very high level of incorporated agreement. Other, they use a similar social partner, and then you have other, they just, doing some softer, non-binding policy document, and then we have 4 countries that didn't do anything yet. So what we learned in our case, I mean, opening Pandora box, when I read in the program, I was, because I remember this word when we were trying to build and we were getting cases to get experimentation of our tools. I remember a human resources manager of a major telecommunication company that would say, we know this, we know it's important, but it's like opening the Pandora box. We don't know where we're going if we start dealing with this kind of stuff. So, and now I think things really change. From one side, we have this decree, because what happened is that in 2008, at the end of a term of the government, they decided Parliament to have in the framework act on OSH, so the highest level, on the general principle that each employer has the obligation to assess all risk for health and safety, including those related to work-related stress in company, according to the agreement. So they put it in a very high level, and that's where the debate came and say, okay, now we have this regulation, what we have to do? Tell us what we have to do. And that's when we came to these guidelines that came from a group made through the Ministry of Labor with experts, social partners again, and also governmental institutions. They developed these guidelines. But it's enough. What we say, we have to have evidence-based tools and methodology to do this path. So there was a long path on a lot of research, a lot of participatory. I won't go on all this detail, but just to show all the paths where we came in 2011 to have a methodology which was developed not only among a research institution and a policy maker, but also including labor inspector representative and social partner, how to have a methodology that could be able, using a web platform, and then a project for monitoring the impact in order to revise. And at the end, we just, very recently published a second edition. When we started doing this, we went also to look around what happened in the other countries. And the UK was the first one we looked. We looked at Belgium, Germany, Spain. And what we really liked was the management standard by UK. Why we like that? We like because it was an holistic and global approach. Was a participatory risk assessment, including all the figure of prevention. What we thought, if we want to have this managed, we have to empower the same people that company are already managing the other risk. So if you're managing the employers, the safety manager, the occupational physician, the worker representative, they have to work together. We have a little army that in more than 20 years of this legislation, they have been trained, they know what they're talking about, they know the company, they know where are the hazards and the risk. So we had to empower these people, train these people and use. So the central role of OSH professional to have validated tool, because what we're going to measure has to be something that is based on those scientific evidence I talked before. And what we focus on this particularly, which are the management standard models. So you have a standard where to refer in terms of demand, on workload and work environment, on control. If you ask to do something, you have to be able to control and give answer to that, to get support, not from the organization, the relationship, that's a lot about climate, the role that you have, that's very critical. In time of cuts, reduction, redundancy, or especially in public administration, where you have a stop or turnover for a long time, you have a lot of ambiguity of roles. So you have a role, but then you really ask to do something else. That's something very critical. And the other thing is change. In time of continuing change in the organization, and that might be different, so from country to country. So the methodology is basically getting a lot of tools in terms of identifying the groups in a company that are similar for risk, to prepare an organization in terms of informing, communicating, what we call preliminary phase, and to set up a group of experts, those that are training, including the workers they have to be trained to be able to give their part. And then we develop a checklist, a specific checklist, how to deal for this group, and in-depth assessment with indicator tool, which is a questionnaire that has been validated for the group, and a report that is very easy to read with color control, suggestion for intervention, and focus group for action plan intervention phase. So these things, and particularly this indicator, has been also validated. What we did more than the management standard, we developed a structured checklist that, thanks to this platform, where basically company can have their virtual office and they can use their methodology, they are also feeding our system. So we have a lot of anonymous, because we only use for research, for having, so we have more than 7,000 checklists, more than 100,000 questionnaires, and we use this to improve the system to be more customized by sector, by dimension of company. So that's an integrated participative model based on theoretical model, having methodology and approaches that are coherent and validating. Training is an important thing. The monitoring from labor inspector as a feedback is part of the system. Monitoring companies and focus development, and also develop more and more tailored tools that can help company to have this complicated. We also have, this was also feeding our secondary analysis research to improve these things. See, I have to say that what we learned, the climate has changed so much that from the Pandora box, let's say, approach, I would say. Now, we're learning a lot from companies. Some companies, we also see some secondary research they did. For instance, in the banking sector, they realized that those branches that were positive in work-related stress management, they were also a very good customer retention and customer assessment. So there is also something that is coming from research in productivity. We're starting also tailoring now to small and medium enterprise and healthcare sector and public administration. And the other things is what we did, that's more technical, so I don't want too much in detail. But what we try now, we publishing now is with the University of Rome, with the psychometrics department, we are validating the checklist as a tool using the indicator tool coming from the same groups. So a checklist as a validated tool and not developed before just by expert development assessment. And that's why we came now to the 2010. Going toward the ends, just to also to be in time, what we're doing now. Of course, the idea is still creating healthy workplaces. We are not forgetting that, of course, coping, resilience, climate is part of the picture. We're not taking out of the picture this. But I think the primary and the most important things when we're talking about policies at workplaces is how to make able to manage a risk and include this. So we're going to have more and more development tailored tools, because the tools at the beginning were for all companies. But of course, if you have a multinational, it's very different from a small enterprise. And different productive sectors. And also the toolkit for intervention. Because sometimes you might assess a risk, and then what? What are the kind of intervention you have to take? So also tailoring intervention. That sometimes when you're talking about intervention, that's probably on employer side. Somebody is judging my style of leadership. It's my business. They don't even know what they are talking about. It's not about this. There might be also something related, but it's not, sometimes it's just a matter of communication. Sometimes it's a matter of training. Sometimes it's a matter of knowing what is the role in the organization. So sometimes it's just a matter of other issues that might interact on psychosocial risk factor. If you have, like we had before, the example of raising the temperature at the workplace from 23 degrees to 27. If you're working in a big open space, maybe in a customer service call, and you have a bad management of the indoor air quality, that is affecting also the psychosocial risk factor and the climate and the relationship. If you're fighting the way where you're sitting because then the air condition is bad. So when intervention makes the people they know at their best, their company, their work, how to translate what we do in this 6th dimension into practical action that improve their workplace. That's what the whole thing's what we're talking about. So just to go, we had a lot of feedback, and 70% of our business are using our methodology, which is for free. Actually, some resistance we got from some psychological experts that maybe they were doing very expensive for big companies, consultancy, and because this is for free, they were, a little bit not very happy. But still, there's a lot of room for consultancy on new way to do intervention, so they're also now learning. But when we start these things in 2000 now, they have this barometer that the European Union is using. It's called ESENER on psychosocial, which is run in 31 countries, so more than 400 million people working in 31 countries. And the European agency in Bilbao is independently doing this barometer every 5 years. So we have a question there that does your establishment have a procedure to deal with work-related stress? And in 2009, we were scoring pretty badly. You see, we were below the average of the European Union. We still have quite a few countries worse than us, but still we were not happy. UK was first, and that was one of also the reason we look at the management standard. After this methodology, the second wave in 2014, we are among the top 5 countries, so we're very close to the end. So it's, barometer is not enough, it's not the only way, but still, it was a very confident. And as a way, we show also another benchmark where we're not as good as the other. With policy, we're still not able to translate bullying and harassment into legislation. It was 2009. And we're still pretty bad in that thing. So in the same survey, when you have really something on action-oriented policy, you do see some differences. At the end, also, I have to say that this was also, besides, we're very glad to be invited here to bring our experience. So thanks again for the invitation, but also other countries were interested. The European Union, they were using as one of the benchmark, the possibility to have a common tool at European level. We do some bilateral comparison with UK. They use a similar base model. Ukraine also is involved. In Japan, they came also have a study visit, a workshop that we did, and very recent New Zealand in summer. We got a site visit to learn about this. Okay, with this closing, just to have a conceptual final things that, so research, I belong to research more, I have to answer to research needs, but then also to deliver in content and processes. But this content and process is a way that comes also regulators and the social partner and the management are involved in the content and process you are developing. And this also, first you have information, advocacy, diffusion, and then dissemination with regulation, enforcement, and services, implementation, and going to the end, which is sustainable health and well-being at work. You have to have a problem to monitor and keep those systems together, but the most important things are these 2 drivers. Participation, so have all to work together in a way that everybody knows what it's about. So everybody has to be open-minded to the roles of the other, and the other is competence. Competence, that's why models and evidence-based is important at every level. Thank you.